Hello everyone. Today, we're exploring Kerendia, known generically as Finerenone. As always, this discussion is intended for educational purposes. If you have health-related questions or need advice, please consult a medical professional. Description: Finerenone, marketed under the brand name Kerendia, is an oral medication categorized as a non-steroidal mineralocorticoid receptor antagonist. It's primarily designed to treat chronic kidney disease, CKD, associated with type 2 diabetes. Approved by the FDA in 2021, Kerendia works by blocking the action of aldosterone, a hormone that can contribute to kidney and heart damage in patients with diabetes. This mechanism helps to slow the progression of CKD and reduce the risk of cardiovascular events, such as heart attacks and strokes. It's prescribed for adults with CKD associated with type 2 diabetes to protect their kidney function and reduce the risk of continued decline in kidney health. Warnings: Finerenone is not suitable for everyone. It should not be used in patients with adrenal insufficiency or those who require or are undergoing dialysis. Additionally, patients with known hypersensitivity to Finerenone or any component of the formulation should avoid this medication. It is also contraindicated in pregnant women due to potential risk to the fetus. Before taking this medicine. Before starting Finerenone, it's critical to discuss your medical history with your healthcare provider. Inform them if you have liver disease, as dose adjustments may be necessary. Additionally, discuss any other medications you are taking, including over-the-counter drugs and herbal supplements, to avoid harmful interactions. Regular monitoring of potassium levels and kidney function is required while on Finerenone due to the risk of hyperkalemia, high potassium levels in the blood. Side effects: Common side effects of Finerenone include hyperkalemia, which can be serious. Symptoms of high potassium include muscle weakness, fatigue, and irregular heartbeats. Other potential side effects include low blood pressure, dizziness, and dehydration. If you experience symptoms like severe dizziness or fainting, it's essential to seek medical attention promptly. Interactions: Finerenone may interact with other medications, especially those that can also raise potassium levels or affect kidney function. It is important to avoid taking potassium supplements or potassium-sparing diuretics while on Finerenone unless directed by a doctor. Always inform your healthcare provider about all the medications you are taking to manage potential interactions effectively. Dosage: The correct dosage of Finerenone is crucial for its effectiveness and safety. Typically, the starting dose is 10 mg once daily, which may be adjusted based on kidney function and potassium levels. Always follow your doctor's instructions regarding dosage and do not adjust it without consultation. Avoid: Patients on Finerenone should monitor their potassium intake to prevent hyperkalemia. Avoiding potassium-rich foods and supplements is advisable unless directed otherwise by a healthcare provider. Additionally, staying hydrated is important, but fluid intake may need to be adjusted based on kidney function. FAQ: People often ask if there are age restrictions for taking Finerenone. Currently, it is approved for use in adults only. Its safety and effectiveness in children have not been established. Closing: That concludes our discussion on Kerendia, Finerenone. Remember, this information is for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider with any questions or concerns you might have. Thank you for joining today's session.